Did you know the Rehabilitation Act of 1973, as amended, calls for the MSRC to prepare and submit an annual report to the governor or appropriate state entity and the commissioner of the Rehabilitation Services Agency and the citizens of Maryland on the status of vocational rehabilitation programs operated within the state. These annual reports can be found at https://msrc.maryland.gov/pages/annual reports.aspx. Introducing the current chair for the MSRC, Dr. Catherine L. R. Jones, a white female with wavy, long, dirty blonde hair, wearing a black suit with a fuchsia blouse, holding a binder as she addresses the council.
Maryland State Rehabilitation Council Annual Report, December 31st, 2025. As the chair of the Maryland State Rehabilitation Council, it is an honor to serve the people of Maryland. The Maryland State Rehabilitation Council is the people's champion for employment of Marylanders with disabilities, for enhanced awareness of the capabilities of students, youths, and adults with disabilities, and for promotion of state and national policies that support those goals. The Maryland State Rehabilitation Council is appointed by the Governor of Maryland in compliance with federal law to monitor, advise, and oversee the Maryland State Department of Education's Division of Rehabilitation Services. Established by the Rehabilitation Act of 1973, as amended, the Council reports its findings annually to the U.S. Department of Education's Rehabilitation Services Administration, the Governor of Maryland, and most importantly, the people of Maryland.
You can read the full report by following the link in the description.
For program year 2025, DOORS updates. Reallotment. In addition to the federal funding originally received for fiscal year 2025 from the Rehabilitation Services Administration, DOORS received a reallotment in the amount of $2 million. MPPI grant. The 5-year Maryland Pathways to Partnership Initiative, MPPI grant, was awarded to Maryland through RSA's Disability Innovation Fund. MPPI partners, DOORS with 4 local education agencies, Allegheny, Caroline, Charles, and Washington counties, 4 Centers for Independent Living, Bay Area CIL, Independence Now, Resources for Independence, and Southern Maryland CIL, the University of Maryland Center for Transition and Career Innovation, MSDE, Division of Early Intervention and Special Education Services, ABT Global, the Parents Place of Maryland, and the Maryland Department of Disabilities, CSAVR. Dr. Eric Bonner, Assistant State Superintendent for DOORS, sent a DOORS designee to the Council of State Administrators of Vocational Rehabilitation, CSAVR, the week of November 3rd through the 7th, 2025, in San Diego, California. Counselor caseloads. Over the next year, DOORS Office of Field Services will continue working to address the imbalance of rehabilitation counselor caseloads statewide. On average, the number of consumers on DOORS counselor caseloads continues to be 2 to 3 times higher than the national average. Waiting list. The waiting list for DOORS services continues to be monitored and individuals moved off as quickly as possible. Each month, the Quality Assurance QA staff evaluate the total number of referrals received, applications for service completed, eligibility determinations made, and the number of eligible individuals added to the waiting list to determine if there are enough resources and staff capacity to move individuals off the waiting list and into active service. When conditions support moving individuals from the waiting list, the QA staff work with DOORS executive team to identify eligible individuals in order of their application date and contact them to confirm the individual is still interested in receiving DOORS employment services. Then, a rehabilitation counselor will work with the new consumer to create an individualized plan for employment, detailing the next steps in their program. Workforce and Technology Services. DOORS Workforce and Technology Services has been working on implementing several community-based workforce programs over the past year, including year-over-year enrollment for WTC programs is up 23% versus last year. Established a partnership with Baltimore City Public Schools, where 4 students have been granted interviews for food service positions, and where Dunbar High School will be used as a pilot site for the food services training program. Anne Arundel County Public Schools had 15 applicants for food service jobs. 2 summer open houses drew close to 550 attendees, and 62% of the attendees came from more than 20 miles away. 4 new pre-ETS programs were offered, targeted to individuals with autism and those with visual impairments. The driver's education program doubled capacity for driver's education classes for individuals with autism, piloted a specific class for deaf consumers, which concluded on August 12th and will be repeated annually. Added a 7th community college, the College of Southern Maryland, to the Pathways program for students with autism. Program provides additional support with self-advocacy, communication, and organizational skills. Partnership with Salisbury University and Warwick Community College to create a hospitality and food service traffic training program on the Eastern Shore. Discuss the ILOB program and how to use community resources and staff differently. Sent 20-plus students to Blind Industries and Services of Maryland for 2 4-week programs. BEP is working on a half-day program on careers in the Business Enterprise program. WTC and OBVS staff are working on a 4-week training for pre-employment transition services in conjunction with the ILOB, Teachers for the Blind, Office of Communications and Accessibility. Maryland State Rehabilitation Council and DOORS held their annual public meetings on September 16th at 4:00 p.m. and the 18th at 10:00 a.m. The state of Maryland is changing its website template to a new content management system called Drupal and will use the MSRC website as their test site. Change in the ADA goes into effect next April and requires digital accessibility across all platforms. 2 trainings will be offered, one in September and one in October. CSAVR is doing a campaign called 100 Stories in 100 Days. One of the stories DOORS submitted was selected and posted on social media. The link is available on DOORS' Facebook page and LinkedIn. MSRC website has gone through several updates. The changes included accessibility features and tabs for joining meetings. Oversaw 230-plus community outreach and education events, providing resources, education, and information. Office of Field Services, OFS. OFS closed out the last program year ending June 30th at 96% of its successful rehabilitation goal. Reconstituted the Self-Employment Committee to review existing business proposals and plans and provide feedback and recommendations regarding approvals. Implemented a revamped pre-employment transition services pre-ETS process for referral applications and qualifications, aimed at improving efficiency and communication with families and LEAs through SARA AI. The system allows LEAs to submit documentation directly into cases, addressing prior feedback received from focus groups. CTCI grant that previously handled referrals closed in July. EARN grant with Howard Community College funded nationally recognized credentials for Certified Logistics Associate and Certified Logistics Technician. Certified Logistics Associate course begins October 22nd, and tuition is free to individuals with disabilities referred by DOORS counselors. Client Assistance Program. The Maryland Client Assistance Program CAP is pleased to reflect on a year marked by meaningful advocacy, expanded outreach, and strengthened partnerships. In the federal fiscal year 2025, October 1, 2024, September 30, 2025, CAP provided information and referral services to over 800 individuals, helping to give the knowledge and resources needed to navigate services throughout the state. Additionally, CAP offered direct advocacy support to more than 100 individuals, supporting them to overcome barriers and move closer to their independent living and employment goals. MSRC Activities MCSRC. The chair of the Maryland State Rehabilitation Council, Dr. Catherine Jones, represented Maryland at the National Coalition of State Rehabilitation Councils the weekend of November 1st through 2nd, 2025, in San Diego, California. Annual Retreat. The MSRC held their annual retreat on August 18, 2025. Agenda items included discussions on the federal budget, quality assurance measures, a demo of the MSRC website, an overview of the guidebook for SRCs, and strategic planning measures. Subcommittees broke out into their own private sessions to identify their vision and goals for the upcoming year. A fully accessible video was created and posted on the MSRC website to highlight the purpose of the MSRC and to capture the day's events. Call to Action Campaign. Chair, Dr. Catherine Jones, held a statewide call to action virtual meeting on July 2, 2025, to update all stakeholders on the risk of losing federal funding for FY26. The call provided stakeholders information on the proposed budget cuts and the means for how Marylanders could advocate on behalf of DOORS. Blindness and Vision Services Committee. Chair, Penny Reeder. Staff Liaison, Tony March. Mission Statement. to ensure high-quality services leading to successful employment and independence are provided for individuals with vision loss or blindness. This committee's focus is on the following. 1. Assist in development and monitoring of program plans and planning activities of the DOORS OBVS, Office of Blind and Vision Services. 2. Participate in the DOORS policy development and review process as related to blindness and vision services. 3. Participate in program evaluation activities to determine effectiveness and outcomes of the DOORS OBVS. 4. Participate in development and review of DOORS priority and standing objectives related to OBVS. 5. Assist in the development and monitoring of the comprehensive system of personnel development regarding staff serving individuals with blindness and vision impairment. 6. Review and monitor DOORS grant for independent living services for older individuals who are blind. 7. Develop means to assess satisfaction of consumers served by OBVS and review findings. Employment and Career Development Committee. Chair, Neil Christopher. Vice Chair, vacant. Members, Labria Shannon, Marlo Lemon, Chandra Smith, Penny Reeder, Kristen Patterson, Michelle Hamlin, Sharia Young, Staff Liaison, Wanda Peel, Tom Liniak. Mission Statement. Including all stakeholders, community rehabilitation partners, CRPs, families, employers, consumers, as we make employment and training opportunities available for differently abled individuals. We will do this by networking, sharing experiences both positive and negative, and educating us to open doors for employment and sustainability. This committee's focus is the following. 1. Educate each other through networking, and maybe more importantly, what doesn't work regarding employing differently abled individuals. 2. Share this knowledge with CRPs. 3. Work on keeping relationships with employers sustainable. What if the initial contact with the employer leaves? What if the DOORS contact is no longer available? Strategies. 1. Highlight at least one CRP DOORS success story from each DOORS region. Encourage businesses to participate in this committee. 2. This committee will meet quarterly at 4 to 5 p.m. on Monday afternoon. Policy and Planning Subcommittee. Chair, Christina Richards. Vice Chair, vacant. Members, Dr. Eric Bonner, Dr. Catherine Jones, Marla Friedman, Chandra Smith. Staff Liaison, Beth Lash. Mission Statement. To establish a team for leveraging our individual talents and expertise to support the Council, and ultimately, the agency in delivering comprehensive and individualized rehabilitation services. This committee's focus is the following. 1. Assist in the development and monitoring of DOORS state plan, program plans, and planning activities. 2. Participate in the development of annual goals and objectives. 3. Review and monitor the comprehensive statewide needs assessment. Strategies. 1. Finalizing the change in policy for self-employment plan for job seekers. 2. Discussing changes or amending current policies to meet the financial restrictions the agency currently has, but with the goal of still being able to serve job seekers. 3. Streamline the process of policy amendment and creation, allowing for public comment and review by stakeholders. Public Relations and Quality Assurance Committee, PRQA. Co-chairs, Michelle Hamlin and Jamie Stoner. Members, Todd Tolson, Dr. Catherine Jones, Hunter Witt, Marla Friedman, Corey Richo. Staff Liaison, Kimberly Schultz. Mission Statement. Marylanders with disabilities and their families and the broader community need clear, accurate, accessible information about public vocational rehabilitation programs and outcomes. The Public Relations and Quality Assurance Committee will provide collaborative communication, outreach, and quality advisory support for the MSRC and DOORS. We will develop and disseminate public information that strengthens awareness of VR services, review quality and consumer experience data, and provide recommendations to improve transparency, accessibility, and service excellence. Our committee will focus solely on internal operations and elevate public engagement, amplify consumer voice, showcase achievements, monitor quality, and ensure that MSRC's work is visible, trusted, and clearly connected to better outcomes for Marylanders with disabilities. This committee's focus is the following. 1. Establish clear, consistent, accessible PRQA messaging aligned with MSRC mission and vision. 2. Expand public engagement and awareness of MSRC programs and impact. 3. Strengthen quality, transparency, and reporting across PRQA deliverables. 4. enhance collaborative storytelling and advocacy support across MSRC and DOORS. 5. Improve PRQA operational excellence and committee enablement. 6. Strengthen PRQA's legislative and stakeholder communication influence. Strategies. 1. Publish updated MSRC messaging and PRQA templates. 2. Launch a structured monthly social media cadence. 3. Publish redesigned, accessible annual report. 4. Launch a quarterly storytelling series featuring consumers, partners, and MSRC committees. 5. Publish an annual editorial calendar aligned with MSRC meetings, state cycles, and legislative timelines. 6. Develop a legislative education packet.
It is with great confidence that I state that Maryland's Division of Rehabilitation Services is a champion in partnering with Marylanders with disabilities to develop employment opportunities. Dr. Eric Bonner, Director of DOORS, and DOORS staff worked closely with Maryland State Rehabilitation Council in developing strategies to better serve our communities. It is with great pleasure to share the Maryland State Rehabilitation Council is operating at full capacity at 26 members strong, actively participating in quarterly and subcommittee meetings.
That was Dr. Catherine L.R. Jones, Chair of the Maryland State Rehabilitation Council. Image description. Dr. Jones is a white female with shoulder-length, softly wavy, highlighted blonde hair parted to one side. She is wearing a white blouse accented by a gold necklace and is smiling warmly. To learn about the Maryland State Rehabilitation Council through the 2025 annual report, follow the link in the description.